agitation, no sleep, and rapid pressured speech. For someone to be diagnosed as in a manic episode, they do not have to be engaging in or displaying all of those symptoms. They do, however, need to present at least 3 of those symptoms, and then in order to meet the condition of bipolar 1, they have to be presenting those 3 symptoms for at least 7 days. It could be longer, but at least 7 days. Now, bipolar 1 disorder means they're having these extended manic episodes, 7 days or more, but it does not necessarily mean that they are dropping into a depressive episode as well. This is a common misconception about bipolar disorder because, as it's often called, bipolar disorder is referred to as bipolar depression, and yet many people with bipolar disorder don't necessarily experience the deep depressive episodes. The second category of bipolar disorder is bipolar 2. So BP2, or bipolar disorder 2, is somewhat different than bipolar disorder 1. First of all, it's characterized most often by the presence of both manic episodes, mania, and depressive episodes, or what's referred to as hypomania. Bipolar 2 is often diagnosed on the basis of the presence of manic episodes that are lasting 4 days or even less. So someone with BP2 might have 4 days of this increased energy, goal-directed activity. They're irritable, they're euphoric, they're not sleeping, etc., but it's only lasting for about 4 days. Or they could be having longer extended periods of mania, but they are hypomanic episodes. They're not quite as intense. So the pressured speech isn't quite as pressured. The impulsivity isn't quite as severe, etc., etc. The other aspect of bipolar 2 is one that I mentioned briefly a moment ago, which is that it's often associated with the drops into the depressive episodes. One person might go from very high highs that last 7 days or more to very low lows, bouts of depression, major depression that can last 2 weeks or more. Other people are rapid cycling by way of 3 days manic, 3 days normal, 3 days manic, and then dropping into 3 days depression. So you want to erase that picture in your mind that manic bipolar disorder is this sine wave, this cycling up and down between mania and depression. It can take a lot of different forms. And again, this is a serious challenge for the psychiatrist to diagnose people because of that fact that they're only getting a snapshot of the person unless they've known them for some time and are working with them for some time. But this is also especially important for those of you that either have bipolar depression or suspect that you might, or that know someone with bipolar depression or suspect somebody might have bipolar depression, aka bipolar disorder. Because if you're noticing that somebody is very manic and then normal, well, that's a very different picture than somebody who's going from very manic to very deep bouts of depression.